Hi there. It's 3 o'clock, so I'm going to go ahead and get started with today's webinar. I'll start with the slides, and we're going to be talking today about ADHD and menopause. The reason we do these webinars, of course, is because knowledge is power, and knowing how your body works gives you the power to take care of it the best. My job, my role as a doctor is to teach patients how their bodies are working, how they're supposed to work, investigating causes why things aren't going right, and to help you to choose the right treatments to make you feel better. ADHD and menopause, I'm starting just to describe some terms so that we're talking about the same things here. I think both of these terms can mean different things to different people, but ADHD, as I'm discussing it, is a genetically inherited neurological difference. That means it goes through families, it's driven by genes, it's inherited through families, and it creates a difference in the way the brain is developed in utero, and then how that brain functions. So it's a genetically caused change in brain function and structure. It leads to many, recognizable traits, and we'll discuss those later. Menopause. Now that is the time in a woman's life when her ovaries no longer make hormones. We have terms like premenopause, perimenopause, postmenopause. But just so you understand what menopause is it's the time in your life when you no longer have ovaries able to make estrogen, progesterone, and testosterone for you. So it's a time when your body enters the deficiency state. Communication in the body. Again, I'm going to talk about some terms. I want to make sure you know what these things mean. Chemicals send messages throughout the body to stimulate actions. One of those kind of chemicals is hormones. And those are signals that travel through the bloodstream. They're made in one part of the body, usually like a gland, and then that hormone is released into the bloodstream, travels around, and signals the cells throughout the body. Neurotransmitters are also messengers that send signals throughout the body to stimulate activity, but this time the chemical is moving along nerves. So instead of going through the bloodstream, it's transmitting itself through nerves. And hormone levels affect the production of neurotransmitters and vice versa. So these two things, when they are out of balance, can affect each other. They can affect the function of the body, the mood, our ability to sleep, all sorts of things. This is a little graphic just to show you hormone activity. So these are two pictures side by side that are essentially the same thing. At the top, you see that red tube, and that is a capillary, right? So that's a blood vessel. And through that is transmitting blood, and the hormones are in that blood. They leave the bloodstream, and that hormone goes and targets on a cell receptor site. I don't know if you can see on the right-sided picture, there's a little triangle pointing down. That on the outside surface of the cell, that's the receptor where the hormone docks. And I usually liken it to a key going into an ignition switch that then turns on the machinery and activates this activity. So that's what you're seeing a representation of here. That's how a hormone works. And this is how neurotransmitters work. So if you see on the left side of the graphic, there's sort of an orange shape. And then to the right of it is that blue shape. The orange shape is the end of a nerve cell that is transmitting information to the one on the left, or on the right, the blue one, which is the receptive cell. So there's a signal being passed through with neurotransmitters. So it's this little gap between the cells where the neurotransmitters have their activity. And so that sends the signal from one cell to the other in a long chain throughout the nervous system. Some of the functions that we recognize that happen with neurotransmitters, they assist us with our sleep, with our cognition, with pain, emotions, memory. So neurotransmitters are highly involved in some of the things that we recognize as menopausal symptoms and that worsen with ADHD. Okay, so we're going to get into what ADHD is. We said it's a neurological brain difference, and it leads to certain predictable traits. One of those is that an ADHD brain and nervous system is very interest-driven. That's where attention goes. And sometimes I'll say we, because I am a woman with ADHD. So I recognize all of these things I'm talking to you about in my own life. And so some of the things that we feel with ADHD is our attention is driven by what we're interested in. Sometimes we can feel restlessness. We can feel hyperactive. There's a craving for novelty. We're easily bored doing the same things again and again. We have an intense curiosity about the world and about life. When we have something that we really enjoy and are very interested in, we tend to hyper-focus. We can have a wide range of interests. We can move from thing to thing, but when we're interested in it, we do really deep dives into things. And so people will think that you're inattentive with ADHD, you're not paying attention to things, but really you're paying attention to things that interest you. And when you do get interested, you can hyper focus in and the whole world melts away while you're thinking about the thing that you want to do. With me, luckily, medicine is part of that. So I really love to learn about the body and how it works. And that has really served me well with my ADHD. Some of the things that you may notice and you've seen in kids is stimming or fidgeting, and lots of movement can actually help with focus, to focus the interest on the attention in. Then another feature of an ADHD brain is executive function difficulties. Executive function takes place in the frontal lobe of the brain, and that is an area where we have some deficits or some differences with how things work. Those executive function problems can make it difficult for us to stay on top of planning, organizing, prioritizing, and following through on actions. Emotions can be dysregulated because the frontal lobe also prioritizes what's important and what's not. And our emotions can really get away with us sometimes because of that frontal lobe, problem. That can also lead to impulse control, difficulty with transitions due to challenges with switching focus. You may recognize this in yourself or others. When you're interrupted in a task and have to move to do something different, it can be really hard to make a quick transition from one thing to the next, and we get a little grouchy when we're interrupted. Those executive function difficulties also lead to social interaction problems, or just things that are affected by the impulse control that we can sometimes lack, and switching our focus. So if we're in a conversation with somebody, we can get that classic squirrel, something caught my attention over in the distance. I'm gonna look at that while you're talking to me. And people don't like losing your attention when they're talking to you. So that can cause some problems with social interactions. Another feature of an ADHD brain is emotional sensitivity. I explain this as the human brain is driven to be social. We are social creatures. Our safety is in numbers. And a human brain is always going to be seeking other people that can lend safety to us. So whether it's, our families, our schools that we attend, other social events, we're always making, judgments about whether we're safe in an environment, if we have support, if there are people that, do people like us in that environment? Do we have people to turn to? Because the human brain is always seeking that comfort of others. It can be really distressing for an ADHD brain, particularly, to feel any sort of rejection. So there's something called rejection sensitive dysphoria. And it's this horrible feeling we get when we feel like somebody is disapproving of us or rejecting us. Some of us become very vocally, I don't care what other people think, and I reject other people's opinions of me. But that's something we learn to do, to mask, because we really do care what other people think of us. And, somebody can just look at us sideways and we'll think, oh no, the world is coming to an end, they hate me. It can be, because of that executive function difficulty, our emotional dysregulation can make us feel really easily rejected by others. Another ADHD set of traits are differences in the way the brain functions in our working memory. This can be really problematic for some people, right? We lose things. I'll talk more about that later, but working memory can be a problem. Our perception of time is altered. We have a different way of feeling time. Time can pass and we don't know it. It can be, it can feel a lot longer or shorter than it truly is. So, this is what makes us run late to things a lot. Our perception of time is just really off. Sometimes people describe it as now or not now. An ADHD brain thinks that way. Is it happening now? Then I'm doing it now. If not, it's later. That's just not now. And sometimes we, miss some steps getting to that, next thing to do. Perceptions can be different. Sensory perception, right? That your senses can be more heightened or dulled compared to others. Usually it's a heightened sense of, like, your hearing is more acute, or your sense of smell is much more acute than others. Maybe you have difficulties with light. Light can be hard on your eyes. So sensory perceptions can be altered. And interoception and proprioception, what those terms mean are how you sense your body in space, and then also how you sense your internal feelings. So interoception is more about sensing what's happening inside your body, paying attention there. And proprioception is more about where am I oriented in space. And sometimes if those things are off, that can be because the cerebellum in the backside of the brain, which is the opposite from that frontal lobe I told you causes our executive function problems. In the backside of the brain, there's the cerebellum, and that helps us with balance and knowing where our bodies are in space. So that can be something that we have a little bit of difficulty or difference with. Learning can be really different for an ADHD brain. It's not as linear as for others. We have unique ways of taking in information and learning. We develop strong pattern recognition, which really helps with learning because we can put things together quickly. We'll sense something that we've seen before and see how it relates to a new thing that we're learning. So we lock in those memories a little bit better. We can recognize when something's happening that may have a consequence because we see the patterns and things that have happened to us in the past. So pattern recognition is a great feature of an ADHD brain. We can be very creative in our thinking or divergent in the way that we think. We can come up with solutions that other people wouldn't come up with. We have an ability to respond quickly in a crisis or emergency. This is something because of that strong pattern recognition. We see what's happening and we can formulate what to do about it next. So we're really quick in an emergency situation, oftentimes, unless we get emotionally overwhelmed. And then thinking in metaphor and symbol is another feature of ADHD brains. We think about things more in stories. So ADHD in women, this is a little different than what the general ADHD picture looks like. All of those things I said previously are true. They're true for men and for women. But with women, it's often missed. I was 52 years old before I got diagnosed with ADHD. It was missed my whole life. But it definitely affected my entire life. That's one thing about ADHD is sometimes it looks like it is something that is caused by trauma, anxiety. There are some of the ways that ADHD people show up in the world that are also mimicked by things like trauma or anxiety. But this ADHD characteristics will be something that you've been with your entire life. You're born with it. It starts, in your childhood and continues into adulthood. We've misunderstood that in decades past. We really thought, it is mostly boys and it's mostly young boys. And then maybe they grow out of it. We weren't diagnosing it in adults at all. But now we're recognizing the way ADHD presents in boys is very different than the way it presents in girls and in women. So a lot of people have been missed with getting this diagnosis. So what does it look like in women? It's more inattentive and less of that hyperactive, and it's less impulsive in the same ways that you would see that in boys. The inattentive type in women, it looks more like our mind is wandering. Our brain is always busy with thoughts. There's never a quiet moment in the brain. If it's not thoughts, it's singing songs in our head. There's always chatter in the brain. We overthink things and can ruminate. And that can get us into trouble when maybe we had a conversation with somebody that didn't go so well earlier, and you just think of it again and again, and think of all the other things we should have said, and you start beating yourself up. So overthinking and ruminating is something you'll see a lot more in women with ADHD than you will see the really hyperactive sort of presentation. Things are more internalized. Again, little girls are socialized different than little boys, and they're trained to be more quiet and helpful and other things. And so with that, girls are taught very young that when they're acting in these impulsive and hyperactive ways, that's not acceptable. And so they will take those messages and internalize them, leading to anxiety, self-esteem issues, shame. And shame is different than, say, embarrassment. Embarrassment's, oh, I did something wrong. Shame is, I am wrong. So this can be something that women feel when they have ADHD. Again, especially if they were undiagnosed and didn't realize this is the root cause of what's happening and why they're getting these labels and feeling this way. But yeah, they turn it in mostly on themselves and can be very critical of themselves. The hyperactivity in women can look like, again, racing thoughts, speaking before you've thought through what you're going to say, speaking very quickly, and switching subjects frequently. So bouncing around in conversations. That can be sort of the hyperactivity that we exhibit. Impulsivity, again, in conversations, it's something, you can't wait till your turn. You interrupt, you talk over your friends. You overspend. Oh, I'm sorry. We're back in the, impulsivity. I got ahead of myself. That's my ADHD brain, guys. Sorry. Interrupting conversation, overspending, risky sexual behavior. Again, it has to tie into that rejection sensitive dysphoria that, we've got impulse control problems and we really want people to like us. And so sometimes that can lead to some risky sexual behavior, unplanned pregnancies. We can develop substance use problems trying to deal with this. Executive function, when we've got problems with our executive function, again, it's the organizing and the planning, because housekeeping has historically fallen mainly to women in households. The house can be a mess. Housekeeping can really falter. We can have difficulty completing projects that we've started, little piles of things everywhere. And hygiene can suffer with executive function problems because we don't prioritize our hygiene. That could be our personal hygiene, it could be our sleep hygiene, or again, the hygiene of our home. Emotional dysregulation, how that shows up for us. You may recognize this with fast mood swings. Why do I get so angry so quickly? But then I calm down and it's like nothing happened. My mood swinging from upset to calm relatively quickly. Of course, that can lead to relationship problems as well. Not having good control over your moods can cause problems with your relationship, be that at work or at home. The emotional dysregulation piece is part of what really makes it difficult for us to initiate tasks. It may be something we really want to do, we really need to do, but we just can't put one foot in front of the other and start doing it. So initiating tasks can be very difficult if our emotions are dysregulated. Now, that sounds like an executive function problem, but really it's more about our emotions, because maybe we're worried, we're anxious, we're nervous about the task that we're going to do, we're perfectionistic about it. And so because our emotions are high around something, and that's can even be if we're very excited and eager to do something. When we have high emotions, our brain can perceive that as a threat or as dangerous. So we kind of shut down and don't do things. Self-medicating because we feel so bad about, being such a moody person, or people misunderstanding us. That self-medicating can be part of the emotional dysregulation too. Self-medicating can include, eating disorders as well as, drugs or alcohol or excessive screen time. That's a new area with self-medicating, is entertaining ourselves to death, right? Just distracting our brains and self-medicating by numbing out with screen time. All right. Other things in women. If you have ADHD and you are a woman, you might recognize that some of those things that I've discussed, the symptoms already, get a lot worse with hormone fluctuations. That can be when we go through puberty. It can be a very difficult time for us. Every month when we menstruate, during pregnancy, during perimenopause, and then after menopause. All of those kind of changes in hormones are going to change how our neurotransmitters are being generated and used. And so we can really struggle more with, PMS type symptoms or difficulty of pregnancy. Working memory problems in women is not necessarily different than men, but in working memory problems, what that can look like is losing things. I swear, I've had to come up with systems to keep me from losing my phone 4 times a day. right? So you may recognize again, if you don't, maybe you don't lose things anymore, but you used to lose things until you've set up systems to prevent that from happening. Because it's so easy to lose track of things. Our memory can be very short. During conversations, you can be speaking yourself, and by the end of the paragraph you were saying, you can forget what you said at the beginning, and and also when other people are talking, you can not be tracking exactly what they're saying. So getting lost in conversations, the working memory problems that are really can be costly, or forgetting to cancel a subscription that you didn't intend to keep with, forgetting doctor's appointments, forgetting deadlines for things, not paying things on time and getting surcharges. So that working memory can be problematic in the ADHD brain. Again, from childhood on. That can change, around menopause, perimenopause, women start getting more forgetful. It's because that already difficult working memory is impacted by the loss of hormones. Other ways, I can read the rest to you here, rereading paragraphs, rewinding recordings, having to listen to them again and again to be able to keep up and track. When things are out of sight, they're out of mind. We forget about things if we don't do them immediately or keep them somewhere where we can't avoid seeing them. Motor vehicle accidents, because, lack of attention and working memory problems, we can be more prone to getting into motor vehicle accidents. With that, rejection sensitive dysphoria, relationship problems, like I said, also, just attaching ourselves to people that maybe aren't so good for us because we just don't want to be rejected. Masking, that's something we learn to do when we're very young. Masking is acting as normal as we can, despite how difficult it might be for us to, get that assignment done on time or not fidget during class, whatever it is that would make us seem abnormal or kind of weird to others. We learn to mask that and not do it, which can make us feel really disconnected from ourselves. We minimize our struggles. We act like, it's not that big a deal. I don't have it that bad. We don't let people know how difficult things are for us, really. And, sometimes we find that we just switch friend groups again and again. We can't keep long-lasting relationships or friends, so we switch friend groups when things don't work out. Now I'm going to get into some of the chronic pain from hypermobility. These are some of the common physical things that happen along with ADHD. Hypermobility is one. And you may recognize this in yourself if you've had a lot of, sprained ankles, sprained joints, dislocations, mystery bruises, problems with your skin, thin skin. Gut sensitivity can also come from hypermobility, and chronic headaches. So some of these things that, a lot of people, we just don't know what they're exactly coming from, can be from a hypermobility disorder that is often found in people with ADHD. Finally, the last little line here is just some of the labels that people with ADHD, women with ADHD will pick up throughout their lives. And this is what can really affect our self-esteem and our self-image as we hear from people, oh, you're clumsy, weird, flaky, lazy, stubborn, forgetful, irresponsible. You have so much potential. Why don't you just try harder? Associated physical conditions, the hypermobility spectrum disorders, I was hinting at that earlier. Hypermobility, what it is your body doesn't produce enough connective tissue to hold together all of its parts correctly. So in our joint spaces, maybe there's not enough cartilage, there's not enough of the ligaments that hold our bones together in the right way, not enough cartilage to cushion them. And so we can have joint pains, we can have joints that dislocate because the connective tissue isn't adequate there. Our skin is connective tissue, it has a lot of connective tissue in it. Our bones have connective tissue, our organs have connective tissue, including our gut and the tube that processes our food. Sometimes the problems with connective tissue there make those tubes kind of lax and floppy and they don't work as well as they should. So we can have problems with digesting food. And also we can have some forms of hypermobility disorders can also have vascular problems, meaning problems with their blood vessels. because collagen, connective tissue wraps around the tubes that are our blood vessels and stabilizes them. And so there could be problems there. So some of the features you'll see systemically, thin skin that bruises or scars easily. It's usually a thin scar, maybe a white or kind of shiny scar. Oftentimes it can show up as acid reflux or IBS. You can see urinary problems with the urinary tract, holding urine or retaining urine. And then in the eyes, this can cause astigmatism. You might notice dislocations, subluxations. That's just where your joint moves slightly off place. It doesn't completely dislocate, but it just kind of shifts. And you may feel that like wiggly loose joints, and that creates an injury in that joint and causes pain. So hypermobility spectrum disorders affect a lot of people. There are some genes that seem to be associated with ADHD, hypermobility, orthostatic intolerance, which can lead to the SIBO, POTS, and MCAS also here. So other associated conditions, orthostatic intolerance, you might recognize this because you would be somebody, maybe you stand up quickly and suddenly you're seeing spots, you're feeling dizzy, you feel like you're going to pass out, maybe your vision just goes black. And orthostatic intolerance, that means changes in body position result in inadequate blood pressure to manage that. So in an acute situation, it can cause dizziness, lightheadedness, visual disturbances, or fainting from standing. So people that stand a long time and faint, this can be that problem. Chronically, this can cause inattention and brain fog. It can cause memory issues, anxiety, sleep problems, headaches, fatigue, and heat sensitivity. In fact, all of these symptoms can be worse with heat, with dehydration, at high altitude, when drinking alcohol, or eating large meals. So if you get symptoms like this after you've been in the heat or at altitude, these things, this might be a concern for you, orthostatic intolerance. It's a problem with our autonomic nervous system, which is what directs either fight or flight or rest and digest. So problems with our nervous system contribute. Now, SIBO, the small intestinal bacterial overgrowth, is a common problem for people with ADHD because of the hypermobility linked to it. And so these folks just get SIBO recurrently. It comes back and it comes back because, again, the gut function isn't adequate to keep things moving through at the pace they should. And in that case, bacteria from the large intestine can work their way up into the small intestine because things aren't being pushed down and out efficiently. POTS is another way of describing that when you stand up fast, you want to pass out. This one is, there's a test we can do to define that you've actually got POTS, and that's you change your position and you get tachycardia, your heart races and your blood pressure drops. So that is something common with ADHD as well. And MCAS is how we say that, the abbreviation. MCAS is mast cell activation syndrome. And our mast cells are involved with immune responses and allergic reactivity. And so a lot of times what this looks like is like allergies. I'll talk more about that in further slides. Speaking of the hypermobility spectrum disorders, it's not something where you can define it as just a mild case, moderate, or severe. It's not a spectrum that goes from mild to severe. The hypermobility spectrum is a lot of different type of symptoms, but they're all related. Joint instability, mast cell activation, which again is like an allergic reactivity sort of thing, or an immune activation, pain, fatigue, GI issues, so problems with digestion, dysautonomia, again, that's your nervous system shifting into fight or flight more quickly than you want it to, headaches, anxiety. Here's another way to look at that same information. And this one, I'll let you know too, that greater than 70% of those diagnosed with HSD are female. So I see this a lot in my female patients, and especially my menopausal female patients, where everything is getting worse because of menopause. Two people with HSD can experience very different symptoms. We can see when they express it this way, you may be somebody who the GI issues are a main cause of problems for you and quality of life issues for you, where others, it's their joint instability that's a problem, or headaches. So it's not the same in every person, but most all of these things are going to be showing up in a patient with us. MCAS and autonomic dysfunction, it contributes to problems with us jumping into the sympathetic side of the nervous system, that fight or flight, when the mast cells involved here release their contents, release their little particles that drive inflammatory reactions. That can also affect the nervous system and shift it into fight or flight. So just because our mast cells are what we call degranulating and releasing their contents, that can cause us to jump into an anxious state through, nothing we could recognize, right? There wasn't an event that made us feel uptight and nervous. It's just our body just shifted into that mode because of these chemicals. Then the opposite, of course, of the fight or flight is rest and digest. That's our parasympathetic nervous system. And that is something, those activities are controlled by the vagus nerve. So that vagus nerve is really important for activating our calming responses and our relaxation responses in our body. And we have ways that we can actually, I don't want to say manipulate that nerve, but utilize that nerve and help the body to calm down by activating that nerve. Things that you may experience with MCAS, it is a really complex condition, right? It causes so many symptoms that most people would just not even recognize was happening, or recognize why it was happening, and they don't seem related. But all of these things can be caused by these mast cells releasing granules of these inflammatory chemicals. It can be the cause of feeling really just exhausted, fatigued, malaise, and anaphylaxis and allergic reactions. So we can see those. Headaches, brain fog. Paresthesia means numbness and tingling. Palpitations in the heart or swelling. Angioedema is when we get swelling. A lot of times it shows up, around the ankles. It can happen around the lips. But it's a swelling caused by an immune reaction. Also, MCAS can cause lightheadedness from low blood pressure. We can get hives. We can get itching. Dermatographism. You see that term there. It's involving the skin. And it's where you would, if you scratched on your skin, if you made a little pattern on your skin just by scratching it, you'd show up with red welting in that area. So it's a very graphic representation of an area that you just touched on your body. Of course, we'd recognize congestion, postnasal drip. Those things come along with sort of that allergic sensation that we get. Epistaxis means nosebleeds. Again, digestive concerns are all listed there. In our lungs, it can create wheezing and a cough. Interstitial cystitis is a type of problem with our urinary bladder where it feels like we've got continual urinary tract infections, but truly it's not an infection. It's just inflammation inside the lining of the bladder that's very uncomfortable, can be caused by this condition. More difficult menstrual cramps and heavier bleeding are also symptoms of this, joint muscle pain, and then problems with their eyes like dryness and burning. So all of these things are contained in that MCAS that can also be part of, goes along with folks with ADHD. Triggers, again, this may just help you recognize in yourself. If you get some of the symptoms on a previous page, the triggers for it, we've got a lot of common triggers here. Emotional and psychological stressors, right? Activating your fight or flight system. Then physical trauma, if you're injured, that can set this ball rolling. Mold exposures, so, check your homes, check to see if there's mold around, if this is concerning to you. Viral infections, things that are chronic that we hold in our body, when they activate again, they can trigger our MCAS. So again, of just infections, inflammation, vaccination, because it activates the immune system. And then environmental chemicals. Some people are really sensitive to toxic metals, pesticides, things in the environment, because that triggers their menopause. Okay, I've talked to you through, the traits of ADHD, the different commonly associated physical problems that can also come along. And so now I'll talk a little bit just about perimenopause and menopause and how that coordinates with ADHD. So perimenopause is the time in a woman's life when her ovaries are starting to generate the hormones differently. Instead of having a regular cycle with predictable flow, predictable days of bleeding, predictable days between bleeding, things start to change in perimenopause. The hormones are being output a little differently by the ovaries, and that leads to a lot of symptoms. This is usually when women are first coming in to see me, is when they're starting to feel really lousy, but they're not quite menopausal yet. Because that menopause, the definition of that, the old way that we would evaluate menopause was it was the one day of a woman's life that marked 1 year since her last period. Well, these days we don't have to wait until it's been a year since your last period to say menopause is here. We know it because we can do lab tests. We can do blood draws and tests to see what your hormones are doing. There are certain ones that will change really dramatically once the ovaries have stopped producing the hormones. And so we can measure that and evaluate menopause earlier and start intervening to help you feel better earlier. So some of the symptoms the symptoms that happen often with perimenopause and menopause are directly because of the loss of hormones, but it also can be because of the hormonal influence on neurotransmitters. So now the hormones aren't adequate. They're not helping you to make the right amount of neurotransmitters. So things start to feel really off in your body. When you're perimenopausal, the first two hormones that start to drop are progesterone and testosterone. That leads to really common symptoms of sleeplessness, paranxiety, fatigue, and low motivation. And then right at the end, when the last of the follicles have been used in your ovaries, the last estrogen is made, then we're done. So estrogen is one that generally we make pretty decently right up until the end. But when that one is lost, finally, it can cause depression, brain fog, low libido, and the characteristic hot flashes and night sweats that women experience. Here's a little graphic of 6 neurotransmitters. We're just going to look at the ones that have the little yellow smiley faces by them. The first one, the dopamine. Dopamine is our pleasure neurotransmitter. It's what motivates us and drives our behaviors. It's what makes us get up and go and do things because we get a little dopamine reward when we engage in activities our brain wants to do. The way it can make us feel is, enthusiasm. It helps with recollection, with cognition, with awareness, with finalizing a decision, and with help with sleep. So dopamine is the neurotransmitter, the main neurotransmitter in an ADHD brain that is underproduced, and the brain has fewer receptors for dopamine. So already from day one, an ADHD brain has problems with dopamine. That's what's lacking. So we don't, again, it's that finalizing the decision, moving forward, starting projects, getting a reward from these things. That's something the ADHD brain will always have problems with from the start. But then the loss of testosterone in perimenopause and menopause really drives this. So when we lose testosterone, we have a harder time with that dopamine. So you can see the things you'd have troubles with. Then serotonin, the next one in line there, that is our mood neurotransmitter. And you probably have heard about serotonin because antidepressant drugs, selective serotonin reuptake inhibitors or SSRIs are really commonly used. They're used a lot for women in perimenopause and menopause. So this is something that's commonly given because women's mood drops, they're depressed, they have, no sex drive, their sleep is poor, they're not remembering things very well. And then the gastrointestinal tract also is benefited by serotonin. So serotonin is one that is influenced by estrogen. So when our estrogen level drops, our mood drops. And so that's something when we bring the estrogen back, it can help make more serotonin for you. Then finally, let's look at the third one we're discussing here, and that's GABA. That's the bottom right corner. GABA is our calming neurotransmitter. It's like the brakes that slows things down. And that one, it calms our brains, it calms our central nervous system, it makes us feel relaxed, reduces our stress, makes us feel stable moods. And that one is highly influenced by progesterone. So the three hormones that are made in our ovaries and then we lose at menopause really influence our ability to make these neurotransmitters. And so the mood effects, the motivation effects, the sleep effects are really obvious where they're coming from. And this is why I say, BHRT, or bioidentical hormone replacement therapy, it improves lives, it saves lives. I hear from my patients regularly how they just feel restored. They feel very different after they start their hormone regimen. Things lift, they feel like themselves again. So replacing hormones lost at menopause is vital to improving the quality of life. Progesterone helps with sleep and relaxing the nervous system. Testosterone helps with boosting motivation and physical strength. Estradiol helps with memory and clear thinking, and also with collagen production, which all of those are also more important for people with ADHD and those, commonly occurring other associated conditions. Treating the associated conditions is important, right? We're not just going to do the hormones and leave it there. We're going to treat all the other conditions that go along with it. And a lot of the symptoms, as you saw, as I was going through all those slides, a lot of things really overlap. The loss of hormones causes symptoms that are similar to having had, hypermobile joints. Joint pains increase in menopause, and it can be just because straight up menopause or because it's worsening your hypermobility. Things that we're going to do besides just replacing the missing hormones is support the body's systems that are affected with that blood pressure regulation problem and the hypermobility. Some of these things include regular exercise that needs to be tailored to your physical limitations. If you've got some loose joints that are, wiggly and prone to injury, you need to change the way you move your body. You can learn some adaptations by going to physical therapy and or occupational therapy. They can teach you how to move your body in ways that won't fatigue it or stress the joints too much. Healthy diet and supplemental nutrients, of course, that's just part of any naturopathic care regimen. But for certain conditions associated here, if you've got POTS, you're going to want a high salt diet or drink, salt in your water so that you get enough of the salt to keep the blood pressure up so you don't faint when you stand up. Or we may limit, if you have MCAS and you already have a struggle with excessive histamine and volatile reactions, we may limit the histamine-containing foods that you eat so that it's not exacerbating the problem. And of course, if you have SIBO or IBS, other dysbiosis, we're going to treat that, knowing that it tends to recur, that we just notice the signs, notice the symptoms, and when it comes back, we just keep treating it. Other associated conditions, I'd be remiss if I didn't say it's not just physical symptoms that we're having to deal with. There are mental health conditions that can come along. If you were a child who, especially a girl, who grew up with ADHD and wasn't recognized as that, didn't get support, were given messages that there was something wrong with you, you can really develop some poor mental health. You can become very anxious. So with that, you can be anxious or depressed. Sometimes really high anxiety feels like depression because we enter a freeze mode where we're so anxious we just don't do anything. And so that feels like depression. A lot of people get misdiagnosed with bipolar disorder, anxiety, depression, when truly it's just ADHD and it's hormonal fluctuations that are impacting that. So treating our mental health is a great idea. Mental health support with a trained specialist who understands ADHD and complex or childhood trauma can also be really beneficial. You really want somebody who understands the complexity of these conditions and how they interrelate, and also somebody who can decide, the difference. Are you somebody who just has, childhood trauma, complex trauma, or do you truly have ADHD? So finding a mental health specialist who can help with that is really important, because you want to rewrite the old scripts that drive your behavior, right? We learned that, oh, I'm lazy, I'm flaky, I'm irresponsible. You think these things about yourself and you act on that, right? It drives how we behave because we have this perception of ourselves that may be faulty. And so going to see somebody who can help us rewrite that, think of ourselves in a new way, behave in a new way can be great. And then also somebody that can help you to improve the function of your autonomic nervous system, shifting from the fight or flight to the rest and digest side of that nervous system. There are some tools. I'll just list a few things here. Vagus nerve toning. There are whole programs you can get involved with to learn about vagus nerve toning, but that's something that systematically calms your body down. And the more you shift from fight or flight into rest and digest, the more you do that, the better your body gets at it. Because right now your body might be really incredibly good at shifting into fight or flight. Immediately we're there, but calming down can be more difficult. So learning techniques like vagus nerve toning to shift that to where we can calm down more readily, more easily. It's a great skill to learn. EFT is emotional freedom technique. They have something called tapping. That's a technique you can do on yourself. You don't need anyone else to do that with you. So it's, self-efficacious to do your tapping. Also diaphragmatic breathing with restricted exhalations. So when we do breathing exercises, some breathing exercises activate the body and drive it into the fight or flight. And some breathing exercises calm it and relax it. And so if we're making sure that the breaths are coming from our diaphragm, our belly movement, that's a calming way of breathing. And especially if as we breathe out, we restrict it. And so it sounds like, or that's restricting the breath as it comes out. That can actually calm us down too. Scanning our body, paying attention to our body and feeling and looking at or wiggling every part of your body in sequence. That scan of your body can also help to calm your nervous system down. There are lots of other at-home calming exercises that, if you're my patient, we can work one-on-one with. I can give you resources. Certainly there are lots of books and podcasts and videos and things that can help you learn these tools. I also don't want to leave you thinking, oh, this ADHD is just a terrible thing. What a burden. It's awful. It really puts us behind in life. Okay, yes, it causes us struggles. There are challenges. It's not an easy way to live because an ADHD brain functions differently than a neurotypical brain. And the world was built for neurotypical people. So it's something that, we can feel very much of a struggle. I do like to think about the strengths though, because there are benefits to the way our brain functions too, right? There has to be. These genes would not have been passed on, through the millennia to get us where we are now, if there wasn't an advantage to this at some point in our human evolution. So the way our brains function has been a benefit at some point in time. It just doesn't really work in the world we're in now. So one of the doctors who I really like to listen to his conversations about ADHD is Dr. Ned Hallowell. And he has this term. He said he would like to change the acronym from ADHD because there is no attention deficit. There is no hyperactive disorder. We're not deficient. We're not disordered. Our brains are just different in what they pay attention to. He wants the acronym to be VAST, which means variable attention stimulus trait, because these are traits, not a disorder. And our attention varies based on the stimulus. And it's just a better way to explain how our brains work that way. So we don't think, oh, we're flaky. It's not, something just really has to get my attention for me to pay attention to it. I have to be very interested in it. Or it has to be very dangerous. That's another thing that gets our attention, unfortunately. Curiosity is one of our strengths, is what propels us forward the most. We're curious about things. We're curious about people, about life. We want to learn. Pattern recognition is a strength of ours. As I said before, we connect ideas quickly. We learn quickly. I remember going back to medical school. I was an adult learner. I went to medical school when I was 38 years old, I had had enough life experience by that time and seen things and learned things that when we were learning some of these very difficult, complex systems in medical school, I already had references from other areas of my life that I could pull those ideas together and connect them and make them make sense much more quickly. So I feel like that pattern recognition was actually a really big advantage to my brain in learning the very difficult things I've had to learn to practice medicine. Imagination is another strength of ADHD. It's our great gift. We're so imaginative. We come up with problem-solving ideas that others just wouldn't come up with. So creativity is also tied in with that imagination. And that's something I'll just focus. Our creativity is something we need to have an outlet for, right? When we have an outlet for our creativity, it is going to settle in on two criteria. It needs to be difficult and it has to matter to us, right? So it's not something that we can do easily and just, work something out and get it out quickly. We need it to be a little bit of a challenge. We need to, struggle with it a little. It has to be difficult enough to hold our attention, and we have to care about it. We have to matter. It has to matter to us. So for, I'll say creativity for me is cooking meals. I love to be creative in cooking meals. I take on new recipes. I try different ingredients, and it matters to me because I'm feeding my body and I'm feeding my husband. I'm feeding my friends. I'm feeding people that matter to me. So for me, if I don't get to do something creative every day, I know I'm cooking a meal every day, at least once or twice a day. And in that, I get to be creative. It's important for, again, our self-esteem and our sense of self that we focus less on perfecting our executive function tasks or organization and more on our creativity. It helps to balance our emotional center a bit more when we can be creative. So again, instead of, if you're going to try to manage your ADHD differently or better than you have in the past, focus on your creative outlet more so than, keeping a tidy bathroom or something. And here's one of my very favorite strengths of ADHD, and that's caring for and loving others. The opposite of that rejection sensitive dysphoria is we care so much about people. Right? It tends to be, our characteristics tend to be empathy, generosity, a drive to be helpful to others, and a strong sense of justice. So strengths of ADHD, I want to leave you with that. Yes, it can create challenges. It can be a lot more difficult when our hormones are out of balance, when we lose them at menopause. Our hormones affect those neurotransmitters that really affect our mood and our memory and our sleep. So all of these things that we struggle with, let's think of those, let's treat those, but also celebrate our strengths. And lastly, I'll just leave you with the message again, knowledge is power. Knowing how your body is working, why it's behaving the way it is, what it's reacting to. So important that you understand. So to achieve and maintain optimal health and vitality, you need to make informed decisions using knowledge about your current health to determine what you're going to do next. That's what we focus on at Living Wellness Medical Center. That's what I focus on in my practice. The main patients that I see are perimenopausal and postmenopausal women. I have noticed a trend in the past year or so. I am seeing more and more and more women that are my patients having ADHD, whether I'm suggesting, hey, do you think you could be? And then they go and they get diagnosed and come back and say, sure enough, that's what I've got. Or I have people that come to me with it, already having a little bit of understanding. And then that also kind of makes it easier to treat their hormones, knowing that the ADHD is present too. And knowing that we're going to have to work on maybe, reasons why their joints are hurting or why they have this, supposed allergic reactivity. So anyway, this is what I do all the time. This is my topic of special focus and interest. So I hope if you learned something in this talk, if you're more interested in learning more, reach out to me, become a patient. Let's work on this together. All right, I'm going to open up the floor. If anyone has a question, go ahead and send me a message through and I'll answer that. Otherwise, you can send it in later, call the office and we'll have a conversation. Okay, well, that is it for today. I hope that was informative and interesting, and I'll see you next time. you.